Hello, this is Eileen Ingles, St. Joseph Orange Chronic Disease Program Manager for Heart Failure, here to give you a quick update in regards to SGLT2 inhibitors for heart failure for patients with reduced ejection fraction with or without diabetes. So SGLT2 inhibitor stands for sodium glucose transporter 2 inhibitor. Primarily, this patient was used for diabetic patients, and over time, they've studied that the patients have also had benefits on heart failure patients with reduced ejection fraction of less than 40%. Per the 2021 ACC guidelines that was published in January of this year, this drug can be added to the current standard of care of guideline-directed medical therapy for heart failure. So it can be used in combination with their beta blocker, angiotensin antagonist, such as ACE, ARB, and ARNI, and also can be added to their aldosterone antagonist. Patients can also be in diuretics, but just have to be cautious because SGLT2 inhibitors also have an action of diuresis and can also cause hypotension. So we'll discuss further as far as the mechanism of action. So what this drug does is that it decreases reabsorption of glucose at the SGLT2 site in the renal tubules. And so aside from glucose being filtered out at this channel, sodium is also decreased as far as reabsorption, therefore causing excretion of sodium. And as you know, where sodium goes, water goes, so it causes a diuretic effect on the patient's system. So since it causes diuresis, it can cause decreased cardiac preload, afterload, and can also down-regulate sympathetic activity, decreasing stress on the heart. Here's an illustration of more specific effects of one of the brands of SGLT2 inhibitors called Farxiga. You can see here where it acts on the kidneys, on the circulation, and on the heart, and also on the neurohormonal effects, which could be over time a benefit for patients with heart failure, causing decreased rehospitalizations. And this is just a literature review looking at studies, randomized studies that were done on the 3 different brands that are out on the market right now. So canagliflozin or Invokana, dapagliflozin or Farxiga, empagliflozin or Jardiance are the 3 brands out right now. Dapagliflozin is the only one that's currently labeled for use for heart failure patients, aside from diabetes. The other 2 brands currently are off-label use for heart failure, but have shown studies that they are safe to use for patients as indicated. So just to break down each brand and to know what to watch for, so canagliflozin is Invokana. It's 100 milligrams once a day for heart failure. This is currently the drug of choice inpatient for Providence. So if a patient comes in with an SGLT2 inhibitor of a different brand, they will be switched to this brand while inpatient, and then when they're discharged, depending on the doctor's order, they can resume this same brand for home. But if the patient is new on this SGLT2 inhibitor at outpatient, we're going to talk more about this, they will be switched to a different brand because currently this medication brand does not have patient coupons for discount, and because this needs prior authorization, we prefer that the patient be discharged on a different brand that has coupons. So side effects to watch out for, and these are pretty similar to all 3 brands, is high risk of genitourinary tract infection or fungal infection, just because the glucose is pulled into the bladder. We just want to make sure that the patients are vigilant about their perineal care, and then also making sure they're well hydrated. Watching out for hypoglycemia is really low risk, but they still need to know the signs and symptoms, and then hypotension. So this is contraindicated for patients that have end-stage renal disease or on dialysis, creatinine clearance less than 30, they cannot have this drug. Peak of this medication starts at about 1 to 2 hours. Half-life is about half a day, so about 10.6 hours. Indications, making sure that if a patient is nauseated or vomiting or NPO, to check with the medical provider to see if when to hold this medication. Recommendation is usually to hold a drug about 3 days prior to the NPO day because of its longer half-life. Recommended to take this medication in a full glass of water to make sure that the patient is hydrated. So if a heart failure patient is on fluid restriction, make sure we double check with the doctor if it's okay to use more fluid on this patient while on this drug inpatient. And then when outpatient, we can give further teaching on how much fluid they can be taking for the heart failure patient. And then if diabetic, the patient can resume their usual blood sugar checks. For both patients that are diabetic and non-diabetic, they need to know hypoglycemia symptoms anyway. You can see CRAMES or Lexicomp for patient handouts, and it'll have all these signs and symptoms listed, so it'll be easier to teach the patient on what to watch out for. And also watch out for volume depletion, which means patient could be on other loop diuretics while this medication while in the hospital. So the doctors might have to adjust their diuretics once they start this medication just to prevent the volume depletion or hypotension. So the second brand is dapagliflozin or Farxiga. So the dose for this medication is 10 milligrams once a day. The same side effects to watch out for, same contraindications. Peak is about the same, about 2 hours. Half-life, also about half a day, 12 hours. So same teaching points, but the only difference is that dapagliflozin is the choice for discharge prescription because this is the only brand with patient coupons for 30 days free. And also, if a patient needs refills on this medication and they have a commercial plan, which is non-Medicare, non-Medi-Cal, non-VA, they can also have zero copay card applied to their prescription. The third brand is empagliflozin or Jardiance. So a lot of maybe diabetic patients you've seen might have this medication already. It's 10 milligrams once a day. So that's the dose for heart failure. Also with these SGLT2 inhibitors, it does not need to be titrated for heart failure, that these dosages are pretty much a fixed dose for that indication. So same side effects, same contraindications, and peak and half-life are about the same, and same teaching points as well. So for these three brands, they are all available at Credena Pharmacy, our outpatient meds to beds program. And we also called CVS Main Street and Levita, and they do carry supplies for this. So just a recommendation, preferred pharmacy at discharge is Credena Pharmacy. So just to make sure that the patient can go home with this medication the same day of discharge. And then to remind patients that they might need prior authorization for this medication for heart failure. So to make sure they follow up with their PCP or cardiologist at their next appointment. So these are the hyperlinks in order to get the coupon savings. So canagliflozin, currently no patient coupons, but this is the hyperlink just in case they need financial support once they get discharged outpatient and the doctor really prefers this brand. The second one, which is dapagliflozin, this is the preferred brand because it has the patient coupon, which is easy to use, 30 days free. And you click on that hyperlink with AsMed's coupon from this PowerPoint when you get a copy, or you can just type it in into the URL at the website at your browser to access these coupons. And when you access these coupons, it'll say free trial on the left and then savings card on the right. So to access a 30-day free coupon, you want to click on the free trial coupon card. And then for empagliflozin, this is just a link for financial assistance in case, again, the doctor or the licensed provider prefers to have this brand for the patient. So in summary, SGLT2 inhibitors are for heart failure with reduced ejection fraction with or without diabetes. The discharge preferred brand is dapagliflozin. So here's a summary as far as patient selection. So it's patients with reduced ejection fraction, EF of less than 40%. Dose selection, it's usually fixed dose, as we mentioned, and contraindicated for end-stage renal disease or severe renal impairment. Considerations, the doctors need to know renal function on the patient, and also to just assess for volume status. The low systolic blood pressure is usually a risk, so just being careful, especially with our elderly patients. And if patient is type 2 diabetes, to make sure they know signs and symptoms of ketoacidosis. Usually this drug is used adjunct with other diabetic medications, and is not used by itself for diabetes. And then also to make sure that they hold this drug, if they're to be NPO, at least 3 days prior to that procedure day. For prescription, we talked about side effects to watch for, and encouragement for the patient to just have really good perineal hygiene because of the risk of genitourinary infection. This is just an image copy of what the coupon should look like. So to the left is the 30-day free trial offer. To the right is for patients that need refill coupon discount. So these are patients for patients that are non-Medicare, non-Medi-Cal, and non-VA. But the one on the left, which is the blue, that can be used by any insurance and also self-paying patients. So a couple of questions commonly asked about SGLT2 inhibitors with heart failure. So we talked about blood sugars are not required to be checked on this medication for non-diabetics. You can use the patient's basic metabolic panel or AM labs for their glucose baseline. But if the prescriber prefers that the patient checks their blood sugars, you can discharge them with the free blood sugar kits that we give out and just have them follow up with their provider or their PCP or cardiologist, whoever sees them at the appointment. And then for both patients, making sure that you discharge them with a CRAMES teaching guide handout for teaching points and side effects to watch for. And then second question was regarding hyponatremia, since it also decreases sodium reabsorption. Per studies, it didn't show significant adverse effects of hyponatremia in their studies. And if there's any questions regarding this drug class at any point for patient questions or discharge needs, you can either contact the discharge pharmacist. They're actually on Monday through Sunday, not just Saturday. And it's from 9 a.m. to 5 p.m. is when you can contact them at extension 54450. I'm on Monday, Wednesday, Thursday, Friday, 9:30 to 6 p.m. Contact me at extension 18109 and or Perfect Serve, or you can email me at my providence.org email for non-urgent questions. So these are my references, and just to let you know that we're here to support you just in case of these patients go home with this new drug class, and hopefully this does help these patients diuresis better so that they could have better quality of life. Thank you for taking the time to listen to this in-service. Have a great day.